I would like to welcome you all to National Single Payer, our webinar this evening. My name is Judy Albert. I'm one of the steering committee members of National Single Payer. I'm also a retired obstetrician gynecologist. And I just want to remind everybody that National Single Payer is a national grassroots organization that organizes locally in the struggle for national single payer healthcare. We're united by the common principles that healthcare is a human right, must be free from corporate profit, and must be achieved through national legislation. If you'd like to support our work, please donate to our organization. We will periodically drop a link in the chat so that you can click and donate throughout tonight's event. Today, the National Single Payer Cuba delegation will be giving the presentation for the webinar. The presentation is entitled "The Cuban Healthcare System Prevails Against All Odds." Before we start, I'd like to give a little bit of history about the NSP Cuba delegation. So going back almost exactly a year ago, National Single Payer hosted a webinar with a representative from the Cuban Ministry of Health. Long story short, we and the attendees at that webinar asked so many questions of our presenter that he, at the end, finally just said, "Why don't you come to Cuba and see our system for yourselves?" And the light bulbs went off in our head, and we thought, well, maybe we could actually make this happen. And we were lucky enough to have been introduced to Lisa Valente, who will be speaking. And soon it became apparent that she could make this trip a reality pretty easily, and has done so many times before. So with that in mind, and knowing that we had a shepherd who was going to make all the connections for us, we reached out to our National Single Payer database and people who had attended the webinar, and solicited those who might be interested. And we ended up with a great group of people. I think it was 14, but I could be off. And we did come up with goals and objectives. And I will go through those now, and then we can reflect after everybody's given their presentations as to how well we did. So our first goal was to understand how healthcare is organized in Cuba, where it's been enshrined as a human right ever since the Cuban Revolution in 1959. We also wanted to use our experiences in Cuba to help us reimagine models of care and organize for national single-payer healthcare in the United States, which is what we're trying to do. We wanted to understand the impact of U.S. sanctions on Cuban society, on the people, on healthcare, and we wanted to be able to join in solidarity with organizations that are calling for an end to the sanctions. Finally, in line with that last goal, we wanted to deliver medical supplies via the organization, Not Just Tourists, and also the Sister Cities Partnership that Lisa represents. So now what I'd like to do is talk a little bit about what our speakers will cover. So we are going to talk a little bit about how the trip came together, what the history of the economic blockades in Cuba is. We will also have an introduction to how healthcare works in Cuba. There will be a discussion of the cultural, spiritual, and political aspects of the Cuban people and their approach to healthcare. We'll talk about medical education in Cuba, specifically the Latin American medical school called ELAM. We will have a discussion about what we learned about the Cuban system and how it might be applied to the organization of a public, not-for-profit healthcare system for everybody in the United States. And finally, we will hear some personal stories from the trip. I will come back at the end and we'll try to go through your questions and also think about whether we did meet our goals. I'd like to introduce the speakers now rather than individually as the presentation goes on, and one can just pass their baton on to the next one. So our first presenter is going to be Lisa Valente, who is the co-founder and current vice president of the Pittsburgh Matanzas Sister Cities Partnership. She has over 47 years of history in the Cuban Solidarity Movement. And what we learned about Lisa is that she has been on the ground for Cuba for many, many years. Next will be Mark Ginsberg, who is a retired professor of comparative and international education, who continues to work with doctoral students at the University of Maryland. He's traveled to Cuba over 20 times, including serving as a visiting professor at the University of Pedagogical Sciences in Havana during the years 2017 to 2019. And he was our guide in the history of Cuba and helping us understand how the sanctions have arisen over the years. Tony Fiorillo is a semi-retired internist who has over 35 years of experience in primary care and also in informatics at the University of Pittsburgh Medical Center. He also recently completed his EMT certification to serve his new community in rural Vermont. He'll be talking a little bit about what we saw in the medical system. Anna Malinow is a retired pediatrician who dedicated her career to serving marginalized refugee and undocumented and poor children across the United States and is currently a member of the National Single Payer Steering Committee. Pablo Dordal works as a national program manager for the Department of Veterans Affairs and serves as an organizer for the Pittsburgh chapter of Veterans for Peace. Claire Cohen is an African-American child and adolescent psychiatrist who's been practicing in Pittsburgh since 1985. She's been active in her community forever, was a founding member of the Pittsburgh Green New Deal, serves on the advisory board of the Pittsburgh Black Workers Center, and is a member of the steering committee of National Single Payer, PNHP of Western Pennsylvania, and the Western PA Coalition for Single Payer Healthcare. Finally, Cheryl Kunis is a nephrologist and a bioethicist. She's clinical professor of medicine emerita at Columbia University, having left Columbia 8 years ago because of the unethical pressures of the profit-driven system. She's now an adjunct clinical professor at Mount Sinai Med Center, where she sees patients part-time and works on healthcare reform as the director of national issues at PNHP, the New York Metro chapter. So without further ado, I would like to yield the floor to Lisa, who's going to do our introduction to our Cuba delegation.
Okay, so thank you for a very gracious introduction. I have been doing Cuba work since 1971, and I realize that's almost 47 years, which freaks me out every time I think about it because it feels like just yesterday. And I've taken many, many groups through with many delegations, all sorts of organizations to Cuba. I've taken veterans groups, I've taken environmental groups, I've taken Jerry Brown. I took all sorts of people to Cuba. And women's groups, pastors groups, and we started a sister city here in Pittsburgh, which, by the way, Mark is a co-founder with me. And so I just kind of take it for granted that, I'm comfortable doing this. But I will say that this delegation was a very special delegation for me because I'm older, times have changed, and the situation is so desperate. And I was taking people that I had no connection to. I'm not a doctor. I'm not engaged in healthcare. I thought these people all had PhDs and they were all going to maybe be stuffy and, they weren't going to pay the slightest bit of attention to an old blue-haired lady. And so I had concerns that it was going to be a difficult group to try to get them to look from a different perspective. But what happened is I ended up looking from a different perspective, and it taught me, we're all on a learning curve, and there's just something you can learn every day. And I learned things every day new when I was with this magnificent delegation because, one, the people are spectacular and I've made lifelong friends, which I'm very confident about. And it was a very difficult delegation for me personally because I had a friend of 40 years who was dying a fairly difficult death of cancer. So to be with a group of doctors at that time when I was seeing my friend in the hospital, not being able to get the type of treatments she really could have used to have made her life a little easier or her death a little easier. It was very hard for me, but it was a convergence. This group was a convergence of help. I never did it in any way alone. It was all of the resources that we've developed for 30 years here in Pittsburgh in relationships. It's the people that from other delegations that I've taken that knew things that I didn't know, because you don't have to know everything. You just have to know somebody that knows more than you do. And there are plenty of those people here and in Cuba. So we worked together here in Pittsburgh with Jim Furlow and our 30 years of relationships. And we worked with many, many different partners. We partnered with a travel agency, Marizul. We partnered with a group within Cuba called Amastur, which does a lot of the local logistics. And through Amastur, we met the most remarkable translator guide, Yanni, and she just won us over every day, lifted us up every day, knew exactly what she was doing, just interacted with the group so magnificently, and gave us insight into her life as a Cuban, how difficult things were. So it was very personal. There was nothing impersonal about this. We worked with ECAP, which is I'm going to say, I get so mixed up with these eyes. It was an Institute of Friendship of the Peoples, which is a Cuban organization that has existed since the revolution, really. And it works with all international organizations and groups. It helps everybody with logistics when they're coming to Cuba, and it acts as an interface with all the ministries and all of the types of groups anybody would want to go to. We worked locally here with the largest humanitarian aid organization to Cuba, a group called Global Links, which works with the World Health Organization. And we were able, through them, to bring thousands and thousands of dollars of very critical aid to Cuba that was coordinated specifically with the hospitals that we took it to. And we also worked with the Not Just Tourists, which is an organization everybody should work with, no matter where, if you're not as lucky as to have a Global Links like we are, where they give you suitcases filled with probably more than $1,000 worth of aid that you can take down to varieties of organizations. And we also worked with Global Health Partners in New York City, which is very specific to doing work all over the world, and had recently done a pacemaker campaign where we successfully were able to bring over 300 pacemakers. And as a result, those people are no longer living in the hospital. So when we went down, we could actually see that those 300 people weren't in the hospital because we came on that trip. Those 300 people were, and the people that we brought, they were going to get assistance that they would not have had if we had physically not carried that good stuff down. And I think it was very moving to, I don't know, people who are in the medical field, they'll have to talk to themselves, because they probably go in hospitals very frequently and see people around and see sick people. But when you see your doctors crying because you're bringing something that they know is going to give relief to a patient that they have that otherwise would not have had that, it's very, very moving. And yeah, very, very moving. So we went both to Havana. When we met with the Ministry of Health in Cuba. We met with ECAP, which I was saying was the Institute of Friendship. Now, the important thing that I think people need to realize is we all don't realize our bias and how dogmatic and the kinds of things that have seeped into our way of communicating. And one of the things is, you ask people, what do you know about Cuba? They'll tell you cigars, cars, and Fidel, maybe, if they're lucky. And so on this trip, when we were able to meet the young people in these organizations that are now in the leadership of Cuba, these people have taken over, they know on whose shoulders they stand, and they have taken over the very difficult job under the longest, harshest blockade in all of human history to try to hold on to their sovereignty and build this country where healthcare is a human right. And I just want to say, for me on a personal level, I haven't really thought much about, I've been so busy trying to change this policy. I haven't really thought about what would inspire people to go through all the suffering that the Cuban people are enduring, to have a revolution and hold on to it. And not just give up and just go over and bend the knee to Uncle Sam. And what I learned was exactly why in the hospitals in Cuba, this necessity the United States has to dismantle a medical system, to make suffering, to not have children be able to have any comfort or peace or pain relief. It is unimaginable to me. And the thing that made me so appreciative of this group is that these are the people in the United States that are really spending their time and energy to try to meet that when I'm in the hospital, I'm going to be able to acquire some of these things and have some of that compassion because we so desperately, our medical system may look better, but it's not a functioning medical system. And we really, really do need a revolution in healthcare. And I guess when I saw the Cuban doctors without even an aspirin to give to their patients, but with hands on at their bedsides, doing everything they could to try to really be a human being, it just woke me up to what this struggle for national single payer is about also, and the struggle for healthcare and how it's all one. I don't know how many minutes I've taken. Do I still have more time to yak on? No, I'm done. But I want to tell all you people that are on the email, whatever this is, a webinary thing, go to Cuba because one, you can carry essential humanitarian aid, whether it's through not just tourists or global links or whatever. The people desperately need it. And two, it will bring you back to your own humanity. It will give you so much faith. And we all need to know what a revolution looks like, because I think we're on a time when we're going to have to start figuring out what ours is going to look like. You can make a big difference in somebody's life, in a life. You can save a life. You actually personally can save a life by taking some medical care to Cuba. And I want to encourage everybody to find a way to get there. Thank you.
Let me go next and try to give back some of the time that Lisa made good use of beyond the 6 minutes each of us had. I've been asked to talk about the context, particularly what I would call, and others have called, the U.S. economic war against Cuba, which provides a big part of the context that we observed and the impact it had on the healthcare system and other parts of Cuban life. I want to start with a quote from somebody who worked for the State Department during the latter years of the Eisenhower administration, who I think they captured very precisely and horrendously, in my view, what U.S.-Cuba policy has been like since that time. This gentleman, Mallory, wrote that because the Cubans are seemingly happy with the revolution, the only way the U.S. can deal with this is that every possible means should be undertaken to weaken the economic life of Cuba, denying money and supplies to Cuba in order to bring about hunger, desperation, and overthrow of the government. Talk about high ideals of our government, which wasn't just a statement, it's been basically the actions and policy of the US. It was under Kennedy that the blockade, or what in the US sometimes is called the embargo against Cuba, the restrictions on commercial activities, on trade and travel between the US and Cuba was first implemented. And there were a whole series of executive orders that put this policy in place. But in 1992 and then again in 1996, there were acts of Congress which codified the blockade, the so-called Cuban Democracy Act of 92 and the Cuban Liberty and Democratic Solidarity Act of 1996, which made it so that an executive, including Obama in later years, who wanted to make changes to the blockade, was not able to do so because it would take an act of Congress. Well, moving to a more recent period, Trump first administration added 243 sanctions. To tell you the truth, at the time he was elected, I didn't think there were that many things that could be done to make the situation worse in Cuba in terms of U.S. policy, including he, few days before he left office, put Cuba on the list of state sponsors of terrorism. And I'll explain that in just a moment. Biden, despite campaign promises, spent almost all of his 4-year term doing almost nothing to improve the U.S. policy toward Cuba. A few days before he left office, he took Cuba off the list of the state sponsors of terrorism, knowing full well that on the first day of Trump II administration, they would be put back on. And just before I explain the state sponsor of terrorism, which is really a reinforcement of the blockade and against Cuba, we now have a group in Congress who, for the second time, are introducing what's called the Force Act, which would codify this placement of Cuba on this list and make it so that only Congress could take them off the list. At the moment, as Biden showed, it was possible with the stroke of a pen to do so. The state sponsor terrorism list makes trade and financing of some of the basic realities of Cuba near impossible. And it's not just a bilateral situation, it's multilateral, because the US government goes after companies and countries that engage in international relations with Cuba and host doctors or supply needed petroleum or other things. Let me just end with two indications, or let's make it three indications of how these policies are viewed globally. First of all, for over 30 times, the United Nations General Assembly has voted to denounce and call for an end of the blockade. Like a lot of international actions, not just under Trump, but under almost all administrations, they're ignored. Nobody decided to change U.S. policy because the UN voted overwhelmingly. Most recently, 187-2. The U.S. plus one other country. Some of you may be surprised that it was Israel that also voted against the resolution. Survey results suggest that the majority of U.S. population wants to see an end to the blockade, and up until recently, there have been some shifts in the Cuban American population, but up until recently, the majority of the Cuban Americans have also wanted an end to the blockade. And finally, according to the UN, at its most recent vote in November of last year, more than $1.499 trillion have been the result of this blockade, an economic impact on Cuba. That's over $35,000 per inhabitant of Cuba over the period of this time. it's an embarrassment to me that my government is responsible for this harm, and it breaks my heart when I see the reality that it has had on Cuba. Um, I think Tony is next.
Yes, I am. Tony Fiorillo speaking. I'm going to ask Anna to bring up my slides. Like all good physicians, it's hard for me to speak to a group without having PowerPoint slides. So bear with me on my PowerPoints. As Judy told you, on starting this meeting, I've practiced for 35 years, predominantly in Pittsburgh, serving various populations of people. And I was very interested in going to Cuba to see how this health system worked. I got a very excellent education, not just from the Cubans, but from our interpreter, as well as all of the other fellow physicians and healthcare workers on the tour. I have to note right from the beginning, one of Castro's very first promises after the revolution was to deliver high quality health care for all and to eradicate illiteracy. And I think by all measurements, many 70 years later, they've been successful in those two areas. Let's move on, Anna. So this is going to be a truncated slide, which I'll catch up on time because Mark did such an excellent job of talking to me about the embargo. And it's hard not to talk about the health system and the impact on this really fabulous system on what the embargo has done. But I'm going to start in 1960. Che Guevara, one of the revolutionaries, was also a physician. He wrote an essay called On Revolutionary Medicine that outlined the priorities of the future healthcare system or the healthcare system they wanted to create under the new Cuban government. It gave national structure to healthcare delivery. In doing so, they established the Ministry of Health, which nationalized and regionalized all medical services in Cuba. That was really important because there was such a great disparity in 1959 and the time before between rural and urban healthcare delivery. Not surprisingly, urban delivery, where the money was, tended to be got a much higher level of quality of care. In reaction to the revolution, in reaction to nationalization of healthcare, one half of the Cuban physician population, almost one half the Cuban physicians, left Cuba. They emigrated out of the country. A major brain drain. But like everything, when there's change, there's a positive change. Fidel and his administration's immediate reaction was to say, we have to start training new physicians. And they did that in a very robust manner. And I'll talk about the medical education, as will Anna in the future. 1965, Cuba legalized abortion, unheard of in Latin American countries or South American countries, and it's been the policy since that time. Sadly, not in our country. 1976, Cuba wanted to truly embed healthcare into their constitution, and they did so by writing numerous articles making healthcare, stating that healthcare is a human right and it will always be free to all of its citizens. In fact, in spite of the economic hardship of the Cuban government, the Cuban government has consistently, budget year after budget year, maintained a high amount of budget dedicated to healthcare delivery. And then the rest of the slide really talked about the embargoes, and I won't go into that there just because Mark pointed out to it, but it really has had a dramatic effect on that by reducing the quality of life of the patients, by reducing available goods for the patient, and then stopping medicines, medical supplies, medical equipment that go to the Cuban people. I have to make a note that the Bush administration even pushed this further in the mid 2000s when one of their proclamations was to encourage all those physicians who participate in international health delivery, because after Doctors Without Border, Cuba was probably the largest single contributor to physicians in war-torn countries as well as disasters. And the Bush told those physicians out there, if you're near a U.S. embassy, go to the embassy, seek asylum, and we'll immediately repatriate you to the United States. Not just you, but your family. And then finally, dear to my heart, because Judy mentioned I did informatics for quite some time, is the Cuba, in spite of all this economic pressure, began implementing a computerized health system called InfoMed. It's an open source software. It is still functioning. It just has not gone down to primary care. So next slide, Anna. So this is the structure. You will commonly read about the structure of it. It is a hierarchical structure, the top being the Ministry of Health and the bottom being the communities and their physicians. It is probably the single best thing that the Cuban government has done for the health of their people, creating a logical hierarchical structure. It starts at the very basic level, the community members. They themselves look out for each other. They truly are a neighborhood. They also have community members who are educated in such things as basic life support and hygiene and stuff, and they educate each other. They also talk to the family doctor, which is level 2. This family physician, primary care physician, not often, is embedded in the neighborhood itself. There are over 33,000 primary care physicians in Cuba for a population of about 10 million people. There's one family doctor and nurse in each neighborhood. Typically, the provider is given a home by the government, and on the first floor is the medical office in the neighborhood where his patients or her patients are. On the second floor is the family and the physician live above, and I'll show you a quick picture of that in a second. The patients are seen frequently. They can drop in the office at any time. They can make appointments, but they can also drop in. The doctor spends his morning seeing patients in the office and often the afternoon making making home visits, making rounds in the neighborhood, understanding what's going on in the neighborhood. The family doctor often has 800 to 1,000 residents in his or her catchment. And that physician is responsible for seeing that everyone receives all the recommended preventive care services, the vaccines, and education. The doctor is also responsible for collecting data that is essential to running a health system. Above the family doctor is the support physicians, the regional polyclinics. There are 436. These are outpatient clinics. They're subspecialists, internists, pediatricians, OBGYN are in those clinics, and they're there to support the community physicians. They are often equipped with x-rays, ECGs, laboratory service, and pharmacies. Extremely variable, though, based on the limited resources. A patient doesn't even need their family physician to refer them. They can go directly to the polyclinic if they want. They will see the doctor on duty, but they can go directly to them. Again, there's meant to be a relationship between the family doctor and the polyclinic. That's fine, Anna. Keep going. Above the polyclinic are the local hospitals, the 149 hospitals in the 15 provinces that make up Cuba. They're general medicine, surgery, pediatric, maternity hospitals in each one of the provinces. This is where the subspecialty physicians practice, both inpatient predominantly, but also outpatient. And above them, there are the medical schools that bring the physicians to that area, support the mission of universal healthcare, conduct clinical research. Out of the embargo has grown biotech industry. Sadly, on our trip there, because of the embargo and because of the lack of electricity, we did not have the opportunity to spend time with the people in the biotech industry. Biotech industry has been responsible for producing mRNA vaccines for the recent COVID pandemic. They are producing an EGF growth factor inhibitor for lung cancer and is now being trialed at Roswell in Buffalo as a preventive medicine or an immunization for lung cancer in the high-risk populations. And one of the outstanding medical schools, and we'll talk to you about, is Elam. The Ministry of Health is Uber alles. They oversee policies and procedures geared to optimizing the public health of the nation. They collect and collate data that comes out of the hospitals, the polyclinics, and also the physicians' offices. Some of that is in Infomed, but sadly, a lot of that is on paper. They have epidemiologists there to track disease and influence the use, and I apologize for the spelling error, but influence the use of their very limited medical resources. They also oversee that biotech industry, the vaccines and pharmaceutical that are produced in Cuba, which there are some that are produced there. So Anna, go ahead. Uh, the next one is meant to be a picture of the primary care clinic that we visited. My limitations, I did not speak Spanish, and sadly, I didn't have a chance to ask the many questions that I had about delivering primary care. But as you can see, this is the home. This is the clinic. This is where the physician practices. This is where the family lives with the laundry upstairs, which I think is just a wonderful picture. The physician and his wife, the nurse, deliver care. And I was very happy to say that we did bring quite a few medicines and basic medical supplies for a primary care practice to them. And it was very gratifying to do so. So onto my comparison, and then I'll end. So I just wanted to, this was my somewhat random thoughts about the difference between primary care and clinical and medical education in the United States versus Cuba. I started off at the very top one because it's so important, the debt of medical school. So Cubans can enter medical school for a 6-year program and a 1-year family medicine after that. So a 7-year commitment after high school. They pay no money for this. This is state sponsored. This is paid for by the government. In the US, just to put this in perspective, 75% in 2024 of all medical school graduates had some form of debt. The average debt out of a public medical school in the United States was $194,000. In private medical school, $219,000. If you couple that to what they acquired, what we students as Americans acquire in college, it is often over $300,000 in debt when starting a practice at age 30. $300,000 plus in debt. The training for Cubans, as I said, 6 years of medical school, 1 year of mandatory family medicine in a neighborhood. Gosh, that is such a great thing. When I think of all the subspecialists who don't even know what a stethoscope is, excuse me for those who are on the call that are subspecialists. In the US, the training with medical school and undergrad is 8 years. No, very few people do less than 3 years postgraduate training, and some go on past those 3 years at 2 to 7 years. So that debt may get extended, and they may be 36 before they start practicing. The number of patients each PCP covers, 150 to 300 sort of active patients. The catchment, as I stated, was 800 to 1,000. Perspective, the AAMC and the American Academy of Family Practice estimates that the average primary care physician in the United States is anywhere from 1,200 to 1,900. And there are many people who have more. There are 400 to 500 active patients in a year. That means more than 3 visits. And the catchment is not geographically located. It could be random. People come into you. And that could be good, but it can also be bad, because one of the beauty of a geographic catchment area for the primary care is to know their community. Social support. This is one of the things that used to drive me crazy, because I had so many patients who were in need and I had no social support. We had a 800 number for the insurance company, but that was useless to both me and the patient. I often had to call up my friends in the hospital, the social service group, to actually get something done for my patients. Yet in Cuba, it's built in. It's the community model. It's the friends, the family, the primary care physician that understands the data and can bring the patient, accelerate the patient's needs up the chain, so to speak. This is something that's really lacking. And yet the government right now is talking a lot about social determinants of health, and all they're talking about is collecting data. There's been very little discussion on what they're going to do with that data. Referral patterns, very structured because it's a hierarchical system in Cuba. In the United States, totally haphazard, based on who you know and who you can cajole to see that patient, assuming you can cajole the insurance company to pay for that visit. Vaccinations in Cuba are delivered by the primary care physician. Community administrators can do it. Some polyclinics do it. But there's been such a change in my 35 years of practice that most of the immunizations I gave in my practice now are handled by the pharmacy. So I even lost that control of giving vaccines to my patients and knowing when they got them. Next slide, Anna, almost done. Home visits. It is mandatory that there's a home visit in Cuba by the primary care physician once a year. Often it happens many more times. In the United States, they don't occur, but interestingly, there's been a slight uptick in home visits, and telemedicine has actually increased that a little bit. But I would argue, having done both telemedicine and home visits, being in someone's home and understanding their illness and their physical situation is enormously helpful for the practice of medicine and understanding your patient. Office keeping mainly by paper. And I must say it was a very rudimentary method of collecting data as I spoke with that primary care physician. It does get transferred daily to the polyclinics and up to the Minister of Health that someone sits down and logs that data in InfoMed. The United States is very happy with the fact that we have over 80% of our physicians who are on electronic health record. But guess what? We don't have a centralized method of capturing that electronic health data. It sits in various silos. Yes, there's interoperability in the United States. But there's no one that's aggregating the data. Interestingly, in the early 2000s, the CDC attempted to aggregate national data, and they were shut down by HHS saying that that was not in their purview to do so. So uh, people have criticized the data tracking in Cuba, but I would argue that our data tracking in the United States is equally flawed. Annual salaries. Annual salaries of physicians in Cuba is $2,700 base, maybe slightly higher for a neurosurgeon, but doesn't rarely exceeds the equivalent of $3,400 per year. Give you an example in the United States, pediatrics, generally primary care physicians, on average, according to Forbes magazine, this is a $235K to $280,000 a year in the year 2000. Ortho and neurosurgeons is $650,000, and trust me, I've known a few neurosurgeon and orthopedic surgeons that exceeded $1 million a year in salary. This, I think, the patient-physician ratio is probably the single most important thing that's close to my heart. Looking at all physicians in Cuba, there are 94 physicians for every 10,000 inhabitants. In the United States, it's 28 physicians for 10,000 inhabitants. This is CDC data from 2019. PCP, 8.6 primary care physicians, pediatricians, family medicine, internal medicine physicians, 8.6 per 10,000 patients, and that's a double AMC in the year 2023. I'm sorry, American Association of Medical Colleges, and double AMC is. You thus have to understand how the physicians in Cuba have the opportunity to really get to know their patient, spend time with them, understand their social network, and deliver better care. Insurance for health is non-existent in Cuba. In fact, it was illegal, although I do understand there's a small private health delivery, but it is sort of under the radar. Our insurance, as you all know, is numerous, impossible to navigate, and the reasons why we're on this call and on many of these calls is because we want to get rid of this insanity. All right, next, Anna. So some of the limits, I mentioned the brain drain before. The brain drain is not just what the United States has been attempting to do and what the revolution did early on, but the salaries, as you know, are low. And so a lot of the physicians see in similar countries, in Dominican Republic, in Latin American countries, that their pay is often higher. And one of the draws is to leave Cuba. So the low salaries are one of the factors. And then I mentioned the Bush administration streamlining it. By the way, that policy was dropped in 2017 on Obama's exit. I don't understand why Democrats have to wait so damn long to get rid of these onerous things, but they seem to do that. The state-sponsored terrorist list is really, really restrictive. It has resulted not just in medical problems, but the decaying of the electrical and power grid impacting the delivery of care. Basic essentials of life are limited, thus health tends to deteriorate. restrictions on imports of medicine, essential good. You can read this. Crumbling infrastructure, really. I think that was obvious when we looked at that. Some of the hospitals and clinics were really not in good physical shape. Although having spent some time in Belarusia many years ago, it looked a lot better than Belarusia. And the limits on fuel, and that was really very poignant because we were at one of the maternity hospitals, and they had a blackout. The whole hospital went black. Eventually, the generators kicked on, but understanding the diesel fuel to run those generators is extremely expensive and extremely limited. I have to finally comment about the health statistics because if you look in the lay press and even in the medical literature, there's a lot of questions about some of the quality metrics that are often quoted, the extremely low infant mortality rate, the low maternal mortality rate giving birth. And they question data because of the collection methods. But I commented about the fact that we don't even have a good collection method. So it's really hard to say, but their numbers are impressive. And I decided not to present them here. So next thought. And my final slide. So, as a physician for 35 years, I'm envious of the structure of the Cuban health system. It would have really made my life so much simpler not to have to deal with all the insurance companies, to know my patients in depth as the Cuban physicians seem to know, and to have the time to spend with them. I think give them, as Lisa had asked, give them the resources, and that population will flourish from a health standpoint. They'll be even better than they are now. And I long for the days in the United States for universal free healthcare delivered in a structured system, because we don't have a system, but delivered in a structured system that places the patient first and removes the profit from healthcare. So thanks. And I'm going to turn it over to Anna from here.
Thank you, Tony. That was excellent. Let me share my PowerPoint presentation. Let's see, it must be here somewhere. All right, there we go. And here. All right, wonderful. Okay, great. So on our second day in Cuba, we visited ELAM. We visited ELAM, which is the Latin American School of Medicine that has been called the masterpiece of Cuba's remarkable healthcare system. And I'd like to thank many members of the delegation for their wonderful photos, many of which I will be using in this slideshow. So ELAM was the vision of President Castro, who at the convocation of the first graduating ELAM class of 2005 said, he said it in Spanish, obviously, but translated, "Onward, invincible standard bearers of the most noble profession, showing us that not even all the gold in the world can corrupt the conscience of the real guardians of health and life, always ready to go any place where need exists and convinced that a better world is possible." So Castro saw healthcare as a social project and the most important human right. Our visit coincided with the 25th anniversary of ELAM. It really is an unprecedented achievement, given the paradox, cruelty, and injustice of U.S. aggression against the Cuban people, and it gives us hope that a better world is possible. The history of ELAM dates back to Hurricane Mitch, which made landfall October 1998, devastating Central America, causing over 11,000 fatalities, setting some countries back 50 years in economic development. Cuba sent rescue missions to the area, and Cuban physicians found healthcare workers overwhelmed by the back-to-back hurricanes because Mitch had been preceded the previous month by another hurricane, Hurricane George. Within weeks, Cuba's political leaders decided to prepare youth in Latin America to be physicians in their own countries, and on November 15, 1999, which was a year later, Cuba opened ELAM to educate youth from Latin America and eventually from all over the world to become doctors. The following year, on September 9th, 1999, The following year, that was in September 9th, 2000, President Castro, speaking at Riverside Church in New York, offered 500 scholarships, and Reverend Lucius Walker, the founder of the Interreligious Foundation for Community Organization, also known as IFCO, accepted the challenge of recruiting students from underrepresented communities to study medicine on a full scholarship. IFCO Pastors for Peace has facilitated the ELAM U.S. scholarships ever since. Now, ELAM is a 6-year full scholarship MD conferring program for global youth to become revolutionary doctors. It is the largest medical school in the world. Year 1 includes 6 months of Spanish immersion, as all courses are in Spanish, and 6 months of pre-med courses. Year 2 and 3 are basic sciences. Year 4 and 5 are clinical sciences in medical schools and hospitals all across Cuba. And year 6 is an internship in family medicine. Almost all U.S. students studying at ELAM are recipients of scholarships through IFCO Pastors for Peace, although they're paid for by Cuba. Non-U.S. residents either have scholarships from the Cuban ministry or subsidized by their own governments or are self-paid. U.S. scholarships go to applicants who are low-income, female, or minority, and who commit to practice in a low-income community. And finally, Cuba expects international students to return to their native country. And this is a photo of the inside of ELAM. Now, since 1999, ELAM has graduated over 31,000 medical students from 122 countries, including 231 from the US, and over 50% are women. And the chart on the right shows that 2012 was a year with the most number of students, 6,900 graduates. And you can see that the numbers on the lower row there have been going down ever since, and we're going to discuss why in a minute. Now, all ELAM students receive tuition and fees, dormitory room and board, 3 meals a day, school supplies, uniforms, textbooks in Spanish, and a modest monthly stipend. And you can see this is a photo of Dr. Claire Cohen from the NSP delegation, surrounded by some of the 50 Palestinian medical students on the ELAM campus. Now, ELAM hopes to train the right kind of doctor. And you can see Paul Dordal, who's going to be speaking with us, with one of the students. To study at ELAM means to revolutionize healthcare, to transform the healthcare system that creates health disparities, to be trained as a doctor from overexploited communities and go back to serve your people, to learn not just to diagnose and prescribe, but to understand that medicine is a matter of social justice, that healthcare is about people, not profit, that healthcare is a human right, and that healthcare must have as its center community and prevention. This is what it means to decolonize medicine, to dismantle the systems that create disease. I encourage everyone to watch the interview of Dr. Samira Adri. She is the ELAM Scholarship Program Coordinator in the YouTube video, Doctors Not Bomb. I'm going to be dropping a link in the chat in a minute. She is really inspirational, and she should be the person talking about ELAM, but anyway, here I am. Now, 60% of ELAM graduates go into family medicine, and you can see that in the green. Now, compare that to the US, where only 12.5% of medical students choose family medicine. And this goes back to some of the things that Tony was talking about. Training revolutionary doctors for free has come at a great price to the Cuban people. As the president of Cuba, Miguel Díaz-Canales, recently said, Cuba has been paying for 66 years the very high price of not having a price. You can see here Cubans lining up to buy bread, and this is a photo from Matanzas, a city east of Havana. The empty shelves in a typical pharmacy in Havana. The makeshift respirator in a polyclinic developed during COVID because Cuba was prohibited from purchasing respirator parts. And the bucket next to a toilet in a patient bathroom of the polyclinic in Havana. If you compare ELAM in 2012 to 2024, after years of unilateral coercive measures, after the pandemic and after Trump, you can see that the combined number of students of year 1 and 2 dropped from 2,500 to 432. And the number of graduates dropped from 6,900 that we saw before to 1,817. Now, U.S. aggression against the Cuban people harms the world and the U.S. One of our action items today will be options for contributing humanitarian aid to Cuba, which is desperately needed at this time. Please use the link in the chat that I'm going to be dropping in a minute to contribute generously, as the Cuban people have so generously contributed to us. Thank you. And I'm going to stop sharing and hand it over to Pablo. Pablo, where is your presentation?
Hola, everyone. Good to see you.
Oh, here it is. Great.
As Dr. Manilow is pulling up my slides, I want to share a quick story. 2 years ago, I was with the National Single Payer Groups in Washington, D.C., during a march where hundreds of us marched demanding that the National Single Payer HR 646 at the time would be voted on. And it was an incredible time, a very good march, and lots of great speakers. And as I was marching, I was wearing my Veterans for Peace shirt, and a reporter who had recognized me from a previous engagement in DC came over to me and said, "Oh, you're the veteran I talked to a few years ago." And I said, "Oh, yeah, good to see you again." And he said, "Do you have a quote for me?" And I just started talking. And he said, "What's so important about national single payer? What's so important? Don't we have good health care in this country?" I said, "I don't think we have good health care. We certainly don't have the money to pay for it." And so I said something, as a veteran, I get all my health care for free. I get literally everything I need in one place, and it's incredible. The VA is universal health care, or, total health care for free for veterans. And I said to him, I said, my wife's been teaching public school for 40 years, and she was in the Bronx, in the South Bronx with us, and in Pittsburgh, and some very difficult places. And I consider her a veteran. Why doesn't she get free health care like I do? And so he took that quote and he put that on his site. And some person wrote there and says, "Oh, she must get insurance from her school." And then before I could even write on that thread, somebody wrote, "Insurance is not the same as healthcare." And I think that's what we're talking about here, that we're not talking about good insurance, if there ever could be such a thing, uh, but we're talking about healthcare, and healthcare available to all, for free, right? And so having grown up in New York City, and been around surrounded by socialists and people who are against socialism and all that, it was so important for me to go. I'm a veteran, Iraq War veteran. I serve with the Veterans Health Administration. But I do think that there are some things done in other places that are better than we do them here in the United States. And so, but I really wanted to see what that might look like in another country. There are a lot of socialists in the United States who have never set foot in a socialist country. And I think it's important that if you're going to say you're something, or you're going to believe in some sort of philosophy of governance, uh, you might want to get some firsthand experience. And I got to tell you, it was an amazing trip for me, as a person who works in the healthcare industry, works for the veterans, that there is a better way, and it exists. And under the worst of circumstances possible, it still provides excellent health care for all. And one of the things that I learned, of course, when you go to another country you've never been to, especially a closed country, is an amazing free country. We live in a free country, but you can't visit another country. That's freedom for you. Uh, but I decided, let me look at the Constitution. What's the Constitution of Cuba like? And the first article, of course, it says that they're a democratic, independent, and sovereign socialist state. And I think the important part, though, is that they are organized by all and for the good of all, for the labor, dignity, humanism, the ethic of its citizens, for equality, for solidarity, for the collective and the individual well-being. I mean, this is an important statement right from the start, that this is a country that's about humans, about human dignity, about human equality and solidarity. And I really, think, we talk about a constitutional crisis in the United States. It may be time for a constitutional convention to adopt the Cuban Constitution. Uh, Bring a little levity to our conversation here. Next slide, please. I took about 900 pictures when I was there, and I loved looking at them video. We were dancing, we went to restaurants. We had a lot of time to dance. Salsa music was in all the restaurants, and but seeing what this simple life of Cubans was so important. And this is just a street I took a picture of. It's a typical apartment in Havana. And people are walking around well dressed, lots of, nice cars. I saw nice cars. Someone told me you won't see a car beyond 1957. And I was like, well, that was rare, actually, to see the old cars. But, Article 71 says everyone has a right to adequate housing and everyone has a right to safety. I didn't see a police officer when I was in Cuba for the entire 9 days we were there. It was so safe to walk the streets at night, anywhere. We were never afraid. And so this is so important that we understand that housing is a human right and that homeless people, we don't see homeless people in Cuba. In fact, the only homeless person I saw was a statue to a homeless person who chose to be homeless. And that was an amazing thing. Someone said in another seminar, if we had a statue for every homeless person in the United States, they'd be statues, hundreds of thousands of them throughout our cities. But in that one city of Matanzas, they honored that person with a statue. Next slide, please. The right to free education. We just heard about that from Dr. Fiorello and others as well. This is so important when you think about not just doctors, but the average student in the United States is graduating with $40,000 to $100,000 in debt. My daughter's going to do K next year, and we're looking at how do we make this work so she doesn't come out of this with debt. And that's the first thing they talk about. How much can you borrow? It isn't even something that's discouraged. Yeah, debt's a part of the American way of life, but not in Cuba. Education, and what a highly educated group of people there. So sophisticated, so intellectual. Next slide, please. Article 15, religious freedom. The state recognizes, respects, and guarantees religious liberty. I think a lot of people don't believe this. And that's the problem with belief. And when you get there and you see it, well, yeah, look at this church. Look at all the churches wherever we were. Beautiful churches. People have the right to go to whatever religion they want to be. The little picture on the bottom was from a mosque that was in Old Havana. And so Muslims, Christians, whatever religion you are, you're allowed to enjoy that and to practice it. So this is a very important, thing to do when you hear the propaganda in the United States against a particular nation. You really need to do some investigation yourself. So like Lisa says, get down there, check this out, see for yourself. If you make like you're from Wisconsin and, show me. I think that's the show me state. Next slide, please. Cultural development. Article 70, all people have the right to participate in the artistic and cultural life of the nation. Whoa, wouldn't you love to have that in our Constitution? I don't know any artist that isn't poor, other than maybe a Hollywood movie star, right? But everyone in Cuba is told to develop this. We saw children doing dances and all sorts of stuff. The picture of it looks like a woman's side face with maybe a horse. That's a roof tile that has been either come off a house or has been removed from a house, and they make art out of everything in Cuba. I mean, it's all over the place. It's like a living museum, the entire country. You cannot walk a few steps without seeing art somewhere. Beautiful art. And just a few examples of pictures I took. And I have hundreds of pictures of the various sculptures. And we talked about the chicken lady a lot, but don't have time to go into it here. But a very, very important piece of art in the center of Matanzas. Matanzas. I still can't say it right. Next slide, please. And of course, what we're talking about, health care for all. Public health is a right of all people, and it is the state's responsibility to guarantee access to quality medical attention, protection, and recovery services free of charge. And this is, the health of the people is the essence of the revolution. And so I think this is such a beautiful thing to look at the Constitution, see what they're saying they're guaranteeing as rights to people, and seeing those rights being fulfilled and exercised in Cuba was quite a eye opener for me. And when I think about our veterans' healthcare system and the incredible high quality care I get, I mean, I'm so happy. I know you've heard of propaganda that there are lots of problems in the VA. Well, there's lots of problems everywhere. But VA healthcare outperforms civilian healthcare consistently, and it's cheaper. And so if we could do it for veterans, we can do it for all. And I think if we follow the Cuban healthcare system, and one last thing I want to say, if this country's poor, let's not kid ourselves, right? But it's made poor. It isn't poor because of absolute mismanagement or the laziness of its people. These are not lazy people. These are beautiful people in solidarity, but this is a made poor country. And it's made poor, I believe, so that if it ever looks like socialism is succeeding somewhere, how embarrassing is that for the United States? And so they have to try to do whatever they can. Yet when we go there, we see it even under the worst of the conditions. We see that socialism is a viable way to exercise governance in the country, free and democratic. Thank you so much. Appreciate the time, and really so thankful to be on this trip.
Okay. Well, my presentation is going to be short, and I don't have slides. If I could have had a slide, if I gotten my act together to get a slide, it would have been 2 slides. One, me with the Palestinian students, and the second one would have been the performance we went to the students, the young kids at this school, dancing and performing and singing and showing us their art and giving us their art. And why do I say that? So, national single payer, those of us in national single payer, we say we believe healthcare is a human right and that we need a system that is about making that right a reality. But when we say healthcare is a human right, we don't just mean when you're sick, you have the right to be healed. We also mean that you have the right to do everything you need to stay healthy and keep healthy and not get sick. And then when you are sick, to be healed. And we believe that a healthcare system, that's what a healthcare system, that's the purpose of a healthcare system. But in our country, people have been convinced, and it has been normalized, that not just healthcare systems, Paul mentioned this, housing, everything else should be about making money. The whole sole purpose should be about making enormous profit for a small, greedy bunch of human beings. And then as a side, not as the primary purpose, but as a side, somehow you can meet these other needs. And we've normalized this idea. And I see this every day in my field. I'm a child psychiatrist, where the system is very broken. People come for help. I see a lot of kids who are suicidal, and somehow they just end up coming back and forth, suicidal, making attempts over and over again, and never really treated. And somebody's making a lot of money. Insurance companies. I work in a private for-profit hospital, but somehow people never get care, and somehow there's no prevention. Somehow the issues in society that play a major role in why people are having these problems never really get addressed, because the system is not about health, helping people stay healthy and get healthy when they're sick. Our whole system is based on helping a few people get rid. So the thing for us going to Cuba, or at least for me going to Cuba, many people have been convinced that it's not realistic to have a system whose basic function, a healthcare system, whose basic function is how to help people stay healthy, stay well, and then when they're sick, get healthy again. And we've almost been convinced, I'm talking about the general population, that that's just not realistic. Can you have a system that's not focused on making profit for a few, that's focused on providing preventative and curative health for people in a humane way? And can that be realistic? And I think what I've learned is Cuba shows that despite all the obstacles and barriers that the United States government has put in its way, it shows that it is a possibility. It is something that's realistic. And that, I think, is the biggest lesson, the biggest that we can get from looking at Cuba, because despite all the barriers that the U.S. has put in its way, it's still doing a fairly good job. There's problems, yes, but but the problems I can tell you because I've been in places in the United States, and some places in the United States in the rural South, Black South, in this richest country on the earth, the healthcare provided is worse than in Cuba. And Cuba has shown that with struggling with resources, they can do a much better job. Also, here, not just in the rural South, state of Pennsylvania, what I have seen is that people can be sick and somehow never get the true health care they need, the health care that really helps them heal, that the services and the community services, we talked about the community support that helps them keep from getting sick. We know that addresses those social determinants that help people keep from getting sick. Somehow they never get addressed, and we never have the money for it, but we certainly have the money for those few greedy people who want it. So for me, the biggest lesson from all of this is that it's possible to have a system that focuses solely on, not as a byproduct, not as a sideshow, but whose main fundamental purpose is helping people maintain their health and provide health. And that what we can learn from Cuba is that that's a possibility, and we need to help. We need to fight to keep Cuba from going under, which is what the U.S., so that we can show the people, yes, it is a possibility. The other thing I would like to say is that one of the things that I noticed about Cuba, most of the doctors are women. And I don't know if it seemed like most of the doctors are people of color. So that is a big inspiration for someone like me, who is a woman and a person of color. And it can be a big inspiration for communities like mine to see that it's possible to have a system that's grassroots, that's diverse, and that meets the needs of, and also at the same time meets the needs of people. So I'll just leave it there. That's a short input, but I hope it's a powerful input and profound input. And I think the last person to talk is Cheryl, who's going to share a story from her trip that I hope fits in with what all of us have been saying. And
Thank you, Claire.
Cheryl
Claire,
was my roommate. And Cheryl,
roommate in Cuba.
Cheryl and I had a great time together, didn't we, Cheryl?
We did. We danced together. We bonded. It was really wonderful. So good evening, everybody, and thank you for staying so long. And I normally always use slides for my lectures in bioethics and my lectures on healthcare reform, but I'm just going to give you a feeling about some of the experiences that I had. But I'm going to start out by saying that sometimes when you do something in life, suddenly the things that start happening right afterwards take on a very different feeling, a very special feeling, and you wonder whether it's real or it's just a coincidence. So I got back from Cuba, and 2 days later, I went to a holiday party for my husband's lab. A bunch of nurse practitioners, all really lovely people. I didn't know a lot of them. And suddenly I started speaking with a woman, a physician I had never met before. And lo and behold, she tells me, I was born in Cuba. And my father was a neurosurgeon in Cuba. And then she tells me, well, what happened is that one night they came to my house. I was a little girl, and they said to my father, you're coming with us right now into the wilderness. He went out into the wilderness, and what was he taken there for? It turned out that Che Guevara had mistakenly shot himself in the head with his gun. But the bullet had gone into his skull, but not into his brain. And they needed a neurosurgeon immediately to take the bullet out of his skull. And this neurosurgeon was taken there. I can't tell you whether this was before or after the revolution. I don't remember, and I'm not sure we went through it. He was taken out there. He took the bullet out of Che Guevara's head. He was taken back to Havana. And I couldn't believe that I had met this woman 2 days after I came back from Cuba at a holiday party. Then the next month, I have a subscription to a dance theater in New York. And I went to 2 concerts that month. The first one was the Afro-Cuban Company of Cuba. And the second one was supposedly the most famous Cuban dance company in Havana. And guess what? This week in my steel drum class, I'm taking steel drums. They're Trinidadian steel drums. We have a new song we learn each week. This week, our song was Havana. So getting back to Havana, let me tell you what happened the first week we were there. In fact, the first couple of days. I was on the bus going back to the hotel when a physician on the bus said, we're going to a concert in town. Do you want to come? Of course I want to come. I'm in Havana. I want to experience everything. We go to this big, beautiful concert hall. We walk in, no tickets, doesn't cost a penny, sat down, and it was an incredible variety show, and supposedly the greatest maestro in all of Cuba was actually playing that evening. It was extraordinary. And I thought to myself, when I said, you don't have to get tickets, I said, this is because they want the Cuban people to appreciate the culture that this country has to offer. It's not like in the US where if you want to buy a Taylor Swift concert ticket for $500 or $1,000, you can't even get it without getting a resale ticket, which means there's a middleman involved. Always a middleman making money on this. Just like in medicine, whether it's an insurance company, a private equity company, or a physician benefit manager, you got a middleman. We have that even when you want to go see Taylor Swift. Getting back to the healthcare system, I've spoken to people who went to Cuba over the years, and what they found really remarkable was that not only do we have the system that everybody's heard about, so I don't want to repeat it, but they really stress primary care. And interestingly, in the United States, they're really pushing for primary care because they understand you really need a core of primary care practitioners to be able to take care of people and decide when they need more care and when they don't need more care, when they have to go to a specialist, when they don't. So in many ways, Cuba started this in 1960. And we're just getting to it now in the United States over the last 25 years. So they really were the spearheads for understanding the importance of primary care. When I was in Cuba, Elsa, who was another member of our team, she and I got off of the bus and said, we're going to go and look for some local color. We're going to go down to the old district and walk around and really try to get a good picture of what this country is all about, not just in the hotel where the Americans were staying and all the tourists. So we were walking around, and of course, everybody's singing La Bamba, but eventually we met an older woman, obviously a very disheveled, very poor woman, living in a dilapidated shanty. And we started talking to her in Spanish. And we explained to her that we are Americans here to see how the Cuban healthcare system is run. And she started telling us all about her health issues and how she goes to the doctor because she has asthma, and the doctor gives her a prescription for prednisone and a prescription for inhalers. But the problem she has is that when she goes to the pharmacy, there's no prednisone and there are no inhalers. So she goes to her doctor. She can't really get treated. She can get the loving care that the physician can offer her. But if she's wheezing away, she can't get the damn medicine. So I guess I left her saying, well, this is the basics are all here in this country, but they can't be realized because our country is strangling them. And I left Cuba saying, one day I see in the future, and I hope it's the very near future. It's not going to be the next 4 years, I guarantee you, but somewhere in the near future, maybe things will change. And maybe the president of our country, like Bill Clinton did after those few men that were left from the Tuskegee trial, which was such an unethical, racist trial that was done by the Public Health Service in America. It started in the 1920s, and Bill Clinton in 1992, 1993 got the 3 men and brought them to the White House. And he apologized for the unethical behavior of the American healthcare system and the racist environment that happened. He apologized. And I am hoping one day our country, whether it's our president or whatever, will apologize to Cuba for what we have done to them. And the last thing I can just say is that I don't like to use the word retirement because I don't want to deal with the fact that I'm getting older. And I use the word reboot. If I am going to be rebooted, I would like to go to ALAM and improve my Spanish. I do speak Spanish. I spent a year in Mexico City as an undergraduate in college. And I speak Spanish with my patients almost every day. But I want to go to ALAM, make my Spanish really fluent, and study medicine again, because then it'll be really fun. I didn't really enjoy medical school when I went. I love being a doctor, but I hate the healthcare system I am having to deal with now. So thank you very much. And thank everybody today who were really wonderful in showing what our mission was, telling you about what Cuba is really about and what it means to have humanity and dignity in this world.
Thank you, Cheryl. I think that was a perfect way to finish up the presentation. We have 6 minutes. There are a couple of questions that I would love to put to people. One is, is BRICS able to help Cuba circumvent the economic blockade from the United States? I'm going to put this to Mark. I'm not sure if any of the rest of us has any other insight about this, but my thought process is no.
Cuba does have trade relations and with China in particular. But of course, the international financial system is a dollar-based U.S. one. And while BRICS is attempting to create an alternative, it hasn't quite achieved that. But yes, Cuba does receive um, shipments of goods that they purchase, and historically, China and Russia, uh, Venezuela, Iran, and others have been involved. But part of the problem is for a relatively poor country and not being able to access the financial system, and actually being blocked by banks, and banks being penalized for dealing with Cuba. It's a really a challenge. It's a longer issue, but I'll just keep it at that.
Yeah, Anna did put an entry in the chat explaining the entry of Cuba into BRICS. There were a couple, I think this will be it. There were several questions about the physician salaries. Is the Ministry of Health trying to make salaries for physicians more competitive so they don't leave? And the other one was are physician salaries comparable to salaries in other professions or jobs in Cuba? And Mark, you're nodding your head. Do you have some information about that?
I would guess others do as well. Uh, Cuba has worked very hard to try to minimize the difference between the least paid workers and the highest paid workers. I'm not sure what the current situation is, but I think medical practitioners probably are near the top of it. But again, the question is, do you want to have doctors being paid 2 or 3 times as much and the rest of the society not getting that kind of increase? The other thing is, for people to understand Cuban compensation, you have to remember that Cubans are not paying for education all the way through, from preschool to university. That's a huge cost for some people in the U.S. Cubans don't pay for health care, which, as we all know, even if you have a good insurance program, with the exception of Pablo's VA situation, it's a big cost. So you have to factor that in. But again, part of the commitment to equity and equality is not just focusing on one occupation and trying to make it competitive internationally. And the last thing I would say is that the one way that medical practitioners, doctors, and nurses can augment their earnings is to participate in the international missions, which we briefly mentioned. For those who travel to Italy during COVID, or who travel to other places, they can receive a stipend. It isn't all, sometimes it's not as much as the Cuban government receives from countries that can afford to pay for it, but it is a way they maintain their current salary that they have in Cuba, and then can supplement it with the stipend. And that is one of the incentives. But I have to say that of the doctors and nurses I've talked to who do international missions, that is a very small part of the motivation. I would say solidarity and commitment to improving the health in other countries is a much bigger one.
I want
I might,
I want to say something about that briefly. The thing is, Cuba is under siege, and the ways that the United States, through the state sponsor of terrorism, that is making it impossible for goods and services to come into Cuba. It is also, Cuba made a very big effort a couple of years ago to have a one currency system. They tried to eliminate the US dollar. However, at the moment, the only way that goods and services are coming into Cuba are primarily through a black market, which is mostly being run out of Miami. And we saw a lot of the type of private enterprises like the restaurants and things like this that could get food. We were eating lobster and being offered things as tourists that were not available to ordinary people. The last time I checked in Matanzas, people were paying $47 US dollars for 12 eggs. So the currency is profoundly impacted, and the majority of people, there is food scarcity in Cuba now that never existed because the Cuban government is unable to buy goods internationally. They're unable to purchase food and milk. They have asked the world, somebody or other
World
organization,
Health Organization.
for the milk, right? Is that, Mark, was it the milk? Yeah. Yeah. Now that's the first time since 1959 that they have not been able to give their children milk. And the whole US blockade is to basically make sure that all of the institutions that serve ordinary human beings, whether it's food scarcity, health, and education, that these are what has to be dismantled. This has to be so that people cannot have any hope or faith that their revolution is worth preserving. So, and that their sovereignty is worth protecting. And it is unbelievably vicious. So when we were there, we were, we had people who would have been in service in their communities, and they were working in the tourism industry because that's where they could get dollars. And so you can't underestimate any of these things, that it doesn't start with the United States. And I understand last night they passed, our Congress passed a bill that's going to, take trillions out of Medicaid, Medicare, and stopping Meals on Wheels and all of these things. So it's not just that the Cuban people are being are paying a thing, but we are too in this country, and that kind of connects it all.
I was just going to add that I was sitting next to somebody at this Cuban dance concert, and she said she was there because she just came back from a trip to Cuba. And she said that on her tour, there were a whole group of doctors moonlighting to make more money. Doctors working as tour guides and waiters.
And taxi cab drivers and all sorts of things. Yep, that's right.
The tourist industry is where the money is in Cuba.
And it's where the dollars are.
Dollars. Well, we are at the end of our time, and I think, judging from comments in the chat and my own experience of listening to all these beautiful friends that I traveled to Cuba with, pulling it all together, I think we can say that we presented our goals, and I think that we achieved our goals. I want to highlight one of the goals, which was to use our experience in Cuba to help us reimagine models of care and organize a national single-payer healthcare in the United States. And I'm highlighting that because I want people to consider participating in our National Day of Action. I think also I would draw your attention to the fact that you can save the chat, and there's a lot of information and websites and contact information that you can get out of that going forward. Anna has dropped the National Single Payer National Day of Action site on our website several times. And so in addition to the very important places that you can contribute to help the Cuban people, You can always contact us at National Single Payer. We may consider doing another trip at some point. I'm not saying it's organized right now, but you know where we are. You know where our website is. Thank you so much for coming, and thank you all of the participants for sharing such a vibrant picture of what we saw in Cuba.
Can I just say one more thing, Judy? Sorry,
Yeah.
I just want to know, for physicians who are interested in helping ELAM students when they come back to the United States, they're looking for volunteers to help them with one of their mini-sex exams. It's a horrible acronym, but at any rate, if you're interested, you can contact us at National Single Payer, or I put in Dr. Adri's email in the chat and you can contact her. Thank you.
Thank you, everybody. Have a great night.